Oftentimes, these cases are only known because parents are reaching out to us, sharing the letter they received from their school district. It's a concern of the state superintendent, who's been asking for more transparency since the beginning. And she's not alone. ABC 15 reporter Nicole Grigg on the calls for clarity with the rise in cases and what it means for businesses.
The question is if there's truly a unified response here in Arizona. There's also calls for transparency from our leaders if businesses and schools go in the wrong direction. This is a statement put out by State Superintendent of Public Instruction Kathy Hoffman. It calls for transparency and releasing COVID-19 cases inside our schools. She says having detailed communications protocols in place and making them publicly available can help provide some level of certainty in these very uncertain times.
Do you think that the state needs to have like a public database of what schools have had outbreaks?
I think that would be helpful if at the state level or at the county level even, but I do think it would be helpful for our public health departments to be able to provide that information.
The governor has not mandated school districts to report COVID-19 cases publicly because of confidentiality and to comply with state law. Districts only report cases to the state. So we asked Superintendent Hoffman why she's calling for this data to now be released. It seems like we're a little late to the game.
I have been calling for transparency all along. Again, it's in our roadmap recommendations that was published earlier this summer. But I am putting this statement out now to reiterate that, to more assertively say this, because we have been hearing increasing concerns.
And for the first time on Tuesday, the state health department giving details on counties like Coconino and Pima counties expected to move back into the substantial spread category. The Department of Health says businesses will only move backwards if all three benchmarks go up: cases per 100,000%, positivity, and COVID-like illness in hospitals. If this occurs, the state will work with the county health departments to determine the next steps.
So the effort right now with the state, it looks quite bifurcated. So there's no consistency. So the lack of consistency erodes public trust.
The state's former director of emergency management and ABC 15 analyst Wendy Smith-Reeve says it's important to have a unified response and know what the repercussions would be if counties go in the wrong direction in all three categories.
What's really important is if we're going to move the goalposts, if we're going to change the guidelines, okay, but you need to be very clear in what that message is and also adhere and demonstrate that you are going to follow through.
As for schools, Hoffman says the recommendation will be to go back to distance learning if a county goes back into that substantial spread category for 2 weeks. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.